Well, the fall and winter seasons bring more than just a change of weather. For those living with psoriasis, the cooler months are particularly difficult. Here to tell us why that is and how people can manage their symptoms is Dr. Mark Jackson, along with Sarah, who has lived with moderate plaque psoriasis most of her life. Good morning to you both.
Thank you for having us.
Good morning.
Nice to have you on. So, Doctor, let's start with you. For those who don't maybe know what it is, what exactly is psoriasis?
Psoriasis is a chronic inflammatory skin condition that manifests as thick, red, scaly plaques. They can itch, they can bleed, they can crack, they can be uncomfortable. And so it's very bothersome physically, but also visually. Seeing those lesions can make many people think it's an infectious condition or something that's transmissible by touching. So that has its own bother. But it's important to remember that it's not a contagious condition, that it's an inflammatory condition. And since it runs a chronic course in so many patients, it's been a real difficult condition for patients for years. And so finding something that's available to take care of that's really important.
Well, yes, and I'm sure it affects people's, self-esteem. Now, how prevalent is psoriasis?
Well, we see the moderate to severe type in about 7.5 million patients in the U.S. alone. A more limited involvement you might see in many more millions. So we know it's very prevalent. So it can occur in men or women equally. We usually see development at about age 20 or a little bit after that, up until about 50. There's a genetic component / predisposition that might make it come on. But in Sarah's case, she developed it when she was 7 years old, and she developed it after she had a strep throat infection. And so you can see it in early ages just like you can in older ages, so any time really.
Right, and Sarah, I want to get to you in just a minute, but doctor, what's the big reason that psoriasis is actually worse in the wintertime?
Well, if you can imagine your own skin in the winter and thinking about the dry, flaky conditions that you can see on your own skin in the cold of the winter months, with the cold air outside and the wind and the dry heat that comes from our furnace, and you being in Tucson understand about the dry air bothering your skin. But if you can imagine what it's like to have psoriasis before you enter those months, you can see how it can just exacerbate this underlying thick, scaly plaque that's already present before you hit those months.
Right, yeah, you're right. If you ignore your skin here in Tucson, you're going to be pretty much dry the entire season now. Sarah, tell us your story. What was your diagnosis like, and what has it been like for you to live with psoriasis?
Yeah, so when I was younger, I noticed that I did have these raised, itchy plaques that were on my skin, and so eventually I was diagnosed with moderate plaque psoriasis, and I found that winter and fall months can be a lot more difficult. And so I take certain steps during the winter, such as taking cold showers to prevent skin irritation, and that really seems to help, as well as managing my stress. But psoriasis definitely affects my relationships with friends and family and strangers who do often think that I am contagious.
Yes, well, those sound like great ways to manage it. And doctor, we're talking about the medicine Otezla, so how does that actually help patients that are suffering with psoriasis?
Well, in years past, we've thought that we had to put something on the skin to make the lesion go away, but since this is chronic, these lesions tend to continuously occur. And so with Otezla, the goal is to try to work to prevent those lesions from developing, and it's an agent that you take by mouth twice a day to try to impact and better control the psoriasis over the long term, so that you don't have to develop the lesion to put something on. You work to try to not develop that, and it's a nice option for our patients. There are other options that are available that you can take internally to control the more moderate to severe types of psoriasis. So if you do have psoriasis, or a patient does, I would encourage them to go seek treatment from their dermatologist, because there are a lot of options available.
It does, yeah, and it sounds like a fantastic solution. And guys, I want to thank you both so much for taking the time and telling us your stories today.
Thank you so much.
Thank you.
My pleasure, and stay where you are. The Morning Blend will be right back.